Hi, good morning, Roger. My name is Mihiraa. I'm your invigilator for the OET-speaking session on the 28th of May 2021. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Roger Phillip.
And what is your candidate number, please?
My candidate number is 232084227.
Thank you. And you are taking this test as a nurse. Is that correct?
Yes, correct.
All right. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
What makes you a good nurse?
I have always been a naturally caring person. I am well suited to the position, as I understand the care system well, have a nurturing approach to patient support, and know how to manage my time. I can handle difficult situations with ease, and will always put the comfort of patients before anything else.
What makes a shift satisfying to you?
At the end of a long shift, I feel really fulfilled when I see how my team has effectively followed all safety procedures, using the proper documentation, how we supported each other throughout some grueling hours, and how we all displayed enough resilience to get up again and conquer another workday.
Where do you see yourself in 5 years?
My plan is to obtain my Master of Science in Nursing, so that I can become an advanced practice registered nurse. I'd love to raise my status to a nursing team leader and even help with training. My dream is to be able to go deeper with patients by evaluating their test results, helping doctors with diagnoses, and referring them to specialists.
Do you work well under pressure?
By nature, I'm very even-tempered, and that has given me strong foundational protection against stress. I also practice mindfulness and meditation daily, which has helped to further strengthen my mind. And recently, I attended a symposium on workplace stress, which taught me about stress reduction techniques, such as taking walks during my lunch breaks to avoid burnout.
How do you deal with a particularly demanding patient?
I stay focused on the patient's needs, and I do my best to not take any disparagement personally. I understand that a patient's attitudes may be colored by whatever pain or condition is afflicting them. If we treat them with respect, sitting down to speak with them, taking the time to listen carefully to their needs, despite your tight schedule, we will be able to find a solution.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your OET-speaking role-play. Don't worry if I stop you when the time is up.
Good morning. My name is Roger Phillip, one of the community nurses working in this locality. For confirmation, am I talking to Mihiraa?
Good morning, Roger. Yes, I am Mihiraa.
Nice to meet you, Mihiraa.
Nice to meet you too, Roger.
Well, Mihiraa, I am here to provide wound care management for you, following your hospital stay with sepsis. How are you feeling about being back home?
Oh, yes. It's really good to be home, but you know, nurse, I don't have very much energy to move around. Also, I am feeling quite tired, and I don't feel like eating.
Mihiraa, I understand your situation. It is natural to feel less energetic and tired, as you are in the recovery stage. However, it is very important to have good nutrition, especially at this stage. Good nutrition will aid recovery, and will build up the strength required for you to lead a healthier lifestyle.
Yes, you are correct, nurse.
By the way, Mihiraa, I would like to know about your food and fluid intake.
Actually, nurse, currently I have a small breakfast, which consists of coffee and toast. For lunch, I take half a sandwich. I usually have ready-cooked meals for dinner, that I microwave.
Okay.
Basically, nurse, I can only eat a couple of mouthfuls. Perhaps, I drink plenty of water, about 8 glasses, and lots of tea.
Thank you, Mihiraa, for sharing your current diet. I'm sorry to say that your current diet is not sufficient and healthy for your body. Don't worry, I can provide some suggestions for you.
It will be of great help, nurse.
I realize that you will be able to eat only less in this condition. But, you should eat often to balance it.
All right, I understand what you mean. I will try, nurse.
That's good to hear, Mihiraa. It is advisable to consume more preferred foods than anything else. Moreover, you need more nutritional high-calorie foods in this stage, and to get adequate nutrition, supplemental nutrition drinks can also be considered. Thus, you will feel more energetic and can recover faster.
Sure, I will follow as you suggest.
Thank you for accepting my suggestions. Well, Mihiraa, may I know, do you have any other symptoms?
No. As of now, I don't have any pain, fever or swelling. Besides, I am sleeping reasonably well, but still, I feel tired all the time.
Glad to hear that you are not experiencing any other symptoms. And Mihiraa, it is quite natural to feel tired, as you are recovering from sepsis. For your understanding, I can explain how a person will be feeling during sepsis recovery.
Sure, I wish to know that.
First of all, fatigue is very normal during the recovery period. Thus, it is not a matter to be concerned, and the recovery will be a slow and gradual process. Mihiraa, do you have any other concerns?
Well, nurse, I am still worried about how tired I am feeling, and that I don't have an appetite. I think I should have some tests done, in case I still have sepsis.
Your concerns are quite reasonable, Mihiraa. Regarding your current condition, you are recovering as expected, and have no other symptoms. Therefore, I can assure you that there is no room for any obvious cause for concern.
Okay.
Let me outline the next steps involved in your treatment. It is essential to continue checking and redressing your wound, and to check vital signs. As a precautionary measure, do you have doctor's appointments periodically?
Sure, nurse, I will. Now I feel a little better, that I have more information.
I am happy to hear that, Mihiraa. Now, can I have your consent to have the wound checked and redressed?
Of course, it's fine for me to have the wound checked and redressed.
Thank you for your consent. Mihiraa, always please feel free to contact us for further queries. I wish you a speedy recovery.
Thank you. That is the end of your OET-speaking role-play. All the best.
Thank you.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.